Next module, stakeholder management in health IT projects. Stakeholder management is a critical component in the successful delivery of health information technology projects. Stakeholders include any individuals or groups who have an interest in the project's outcome, including the healthcare providers, patients, administrative staff, IT team, regulatory bodies, and external partners. Effectively managing stakeholders ensures that their needs, expectations, and concerns are addressed throughout the project lifecycle, contributing to greater acceptance, engagement, and ultimately project success. This module explores the principles of stakeholder management, its importance, strategies for effective engagement, and best practices tailored to health ID projects. Firstly, importance of stakeholders management in health IT projects. Managing stakeholders effectively is vital for several reasons, such as alignment of goals, facilitating communication, reducing resistance, enhancing user adoption, and improving outcomes. Firstly, alignment of goals. Engaging stakeholders ensures alignment between the project objectives and the expectations of key users, helping to clarify priorities and deliverables. When stakeholders feel their input is valued, they are more likely to support the project. Next, facilitating communication. Effective stakeholder management facilitates open lines of communication. This helps build trust and transparency, allowing for the timely sharing of information and addressing concerns before they escalate. Next, reducing resistance. Engaging stakeholders early in the project can help identify potential resistance points, allowing project teams to address concerns proactively and mitigate opposition to proposed changes. Next, enhancing user adoption. Early involvement of end users and stakeholders in the planning and development of health IT solutions enhances user buy-in and increases the likelihood of successful adoption of the technology. Next, improving outcomes. Considering stakeholder feedback and perspectives in project decisions can lead to more effective solutions, resulting in better patient care and user satisfaction. Next, identifying project stakeholders. The first step in stakeholder management is to identify all relevant stakeholders associated with the health IT project. These include internal stakeholders and external stakeholders. Firstly, internal stakeholders. This includes healthcare providers such as physicians, nurses, administrative personnel such as billing and scheduling teams, IT professionals, and leadership management teams who will either use or be affected by the new technology. Next, the external stakeholders. External stakeholders may include patients, regulatory bodies, payers such as insurance companies, vendors of health IT solutions, and consultants. Each group may have different needs and expectations regarding the project. Next, analyzing stakeholder needs. and interests. Once stakeholders are identified, it is essential to analyze their needs, interests, and influence regarding the project. These include stakeholder mapping, assessing influence and interest, and gathering feedback. Firstly, stakeholder mapping. Utilizing stakeholder mapping tools help visualize stakeholders based on their level of influence and interest. This mapping helps prioritize engagement efforts based on potential impact on the project. Next, assessing influence and interest. Classifying stakeholders into categories such as high power, high interest, and low power, high interest, etc., provides insights into how to manage each group effectively. High power stakeholders may require more focused communication and engagement. Next, gathering feedback. Conducting surveys, interviews, or focus groups with stakeholders provides valuable insights into their perspectives and expectations. This input can guide project planning and scope definition. Next, strategies for effective stakeholder engagement. To ensure successful stakeholder management, effective engagement strategies should be implemented. These include developing a communication plan, involving stakeholders in decision making, establishing regular touch points, encouraging feedback and input, and addressing concerns proactively. Firstly, developing a communication plan. A clear communication plan outlines how and when stakeholders will receive project updates, information, and feedback opportunities. Tailoring communications based on stakeholder preferences and needs fosters better engagement. Next, involving stakeholders in decision making. Involving key stakeholders in critical project decisions fosters a sense of ownership and commitment to the project's success. This engagement can include participation in project meetings, workshops, and early testing phases. Next, establishing regular touch points. Providing regular updates through meetings, email newsletters, or status reports keeps stakeholders informed and engaged. Consistent touch points help build trust and create a shared understanding of progress and challenges. Next, encouraging feedback and input. Creating channels for stakeholders to provide feedback ensures that their voices are heard. This input can be gathered through formal mechanisms like surveys or informal discussions to maintain an ongoing dialogue. Next, addressing concerns proactively. When stakeholders express concerns or challenges, addressing these issues promptly demonstrates responsiveness and commitment to collaborate problem solving. Next, monitoring stakeholder engagement. Ongoing monitoring of stakeholder engagement is essential to assess if strategies are effective and to adjust approaches as necessary. These include evaluating engagement effectiveness, adjusting strategies as needed, and documenting lessons learned. Firstly, evaluating engagement effectiveness. Regularly assessing stakeholder satisfaction and engagement levels can inform necessary adjustments in communication strategies. Gathering feedback on engagement initiatives is critical to improvement. Next, adjusting strategies as needed. Being flexible in stakeholder management approaches allows for a responsive and adaptive framework. Stakeholders' needs can evolve, and being transparent about changes keeps everyone informed. Next, documenting lessons learned. Throughout the stakeholder management process, documenting best practices and challenges faced can provide valuable insights for future projects. Sharing these insights with teams can improve stakeholder management strategies over time. In conclusion, effective stakeholder management is essential for the success of health IT projects. By recognizing the diverse needs and interests of project stakeholders, health IT professionals can foster collaboration and strong relationships that are essential for driving projects to successful completion. By engaging in systematic stakeholder identification, analysis, and management, project leaders can create an environment that encourages participation, minimizes resistance, and enhances overall satisfaction with project outcomes. Here are additional key elements for effective stakeholder management in health IT projects. These include building relationship and trust. The foundation of effective stakeholder management lies in developing strong relationships based on trust and mutual respect. These include personal engagement, transparency, and consistency. Firstly, personal engagement. Taking the time to meet stakeholders personally, whether in one on one meetings, group discussions, or informal settings, helps build rapport. Personal engagement fosters open communication and encourages stakeholders to voice their opinions and concerns. Next, transparency. Maintaining transparency throughout the project helps stakeholders feel informed and involved in decision making process. Providing clear insights into project goals, timelines, and challenges builds confidence in leadership. Next, consistency. Regular interactions and consistent messaging provide reliability in stakeholder communication. Consistency reinforces trust and demonstrates commitment to stakeholder engagement. Next, adapting to stakeholder feedback. Effective stakeholder management requires openness to feedback and the willingness to adapt project plans based on input. These include iterative feedback loops, responsiveness, and facilitating consensus. Firstly, iterative feedback loop. Establishing mechanisms for ongoing feedback, such as regular surveys or focus group discussions, encourages continuous dialogue with stakeholders. Iterating on stakeholder input can lead to refined project strategies and enhanced solutions. Next, responsiveness. Actively responding to the feedback received is critical. When stakeholders see that their input contributes to the meaningful changes, they are more likely to remain engaged and supportive throughout the project. Next, facilitating consensus. In instances where stakeholder interests may conflict, skilled project managers must facilitate discussions to find common ground and negotiate solutions that balance differing perspectives. Next, training and education. In health IT projects, stakeholders might have varying levels of technical expertise. Providing adequate training and education can help bridge knowledge gaps. These include workshops and training sessions and educational material and resources. Firstly, workshops and training sessions. Offering trainings for stakeholders on new technologies or processes ensures all parties understand how to effectively interact with the system. Tailoring these sessions to specific roles enhances their relevance and effectiveness. Next, educational materials and resources. Distributing user manuals, quick reference guides, or online resources helps empower stakeholders and ensures they have access to necessary information as they engage with new systems or processes. Next, conflict resolution skills. Conflicts among stakeholders can arise due to differing priorities, perceptions, or misunderstandings. Developing conflict resolution skills is essential for proactive conflict management and mediating discussions. Firstly, proactive conflict management. Addressing potential conflicts early before they escalate requires vigilance and communication. Recognizing signs of disagreement among stakeholders can prompt timely discussions to resolve issues. Next, mediating discussions. Skilled leaders can act as mediators in bridging gaps between conflicting stakeholders. Facilitating open discussions that emphasize the common goals can help to navigate sticky situations effectively. Next, leveraging technology for stakeholders. Technology plays a significant role in facilitating stakeholder management in health IT projects. These include collaborative tools, project management software, and feedback platforms. Firstly, collaborative tools. Utilizing collaboration platforms such as Microsoft Teams, Slack, or Asana allows stakeholders to communicate effectively and share information in real time, maintaining engagement and collaboration regardless of geographical locations. Next, project management software. Tools like Trello, Jira, or Money.com can help project leaders track progress, assign tasks, and monitor milestones. These tools enhance visibility into project status and facilitate communication among stakeholders. Next, feedback platforms. Implementing online survey tools such as SurveyMonkey or Google Forms can streamline the collection of stakeholder feedback and opinions, ensuring that their voices are heard and considered in project decision making. In conclusion, stakeholder management is a vital component of health IT project management that directly impacts the success of technology implementations within healthcare organizations. By engaging in comprehensive stakeholder identification and analysis, fostering strong relationships, being responsive to feedback, and addressing conflicts proactively, health IT professionals can cultivate an environment conducive to collaboration and teamwork. Furthermore, leveraging technology enhances stakeholder engagement and ensures that communication remains clear and consistent throughout the project lifecycle. As healthcare continues to advance and evolve, excelling in stakeholder management will position health IT professionals to deliver impactful solutions that improve patient care and enhance organizational efficiency. By prioritizing effective stakeholder management, professionals can play a crucial role in leading successful health IT projects that meet the needs and expectations of diverse stakeholders across the healthcare landscape. Thank you.